And now I want to introduce you to our moderator. Royce Wolfe is one of the newest members on our board, and he's been a great asset to us. Royce is a very multi-talented kind of guy. He's got degrees in journalism as well as master's degrees in both business and ethics and applied philosophy. And he's had a couple of careers, I think, at least, in journalism as well as marketing and sales. And he is now the principal of Through Traffic Marketing.
Thank you, Jessica. You know, this is a great group. I got to tell you, it's a great group, and I've had a lot of fun, and I've learned a lot. As you can tell from my background, I'm not a doctor, but listening to the doctors as well as other people with this, skills in this area, we're all passionate about healthcare justice. And, other countries have declared healthcare a right and not a privilege. And in the United States, you can get healthcare if you can afford it. We talk about having equal opportunity and having the ability to be treated equally and not based on your age, your sex, or your race. And what I think you're going to hear tonight is about American racism in healthcare. American racism is uniquely white. It's, as we say, it's a white person's problem. It's no different from any other type of disease, but it's not going to change unless we are anti-racists, and that is fighting against racism. So you may ask yourself why Dr. Saxe is going to be delivering a presentation on racism in healthcare as a white person. However, unless we start to have this conversation, we're not going to move forward. Racism will not be unchecked. And as everybody can see in the pandemic, there is great inequity and disparity in outcomes. So what you're going to hear tonight is Dr. Saxe delivering the presentation. And Jessica, why don't you go ahead and start?
Thanks to all of you for coming out for what I think is a very important topic. And usually at this time of year, what we do is talk about Medicare for all. But this particular year, the pandemic has uncovered issues of racial justice that are really critical to our understanding of the problems in our healthcare system and the solutions to them. And we thought that it was really important to talk about this. So if you picture our healthcare system as a shawl, which should warm you and make you feel secure, the pandemic is like taking that shawl and holding it up to the light and seeing that it's full of holes and watching the holes get larger in front of your eyes. And an epidemic shows in a short period of time what's been going on for hundreds of years. And that's what this has done with regard to the issue of racial justice. So what I'm going to talk about today is where we are with the pandemic and inequities, and how that relates to the inequities that are already there, and specifically about how racism itself is a factor. And then I'm going to talk about some of the solutions. So what's the toll on African Americans of COVID-19? Now, probably you all are familiar with some of these things, but African Americans, as well as other minorities, are twice as likely to die as white people. And 1 in 735 Black Americans has died of COVID-19 compared to 1 in over 1,000 whites. If we look at the Charlotte area and we take out the deaths that are related to long-term care facilities, 3 out of 4 deaths are in people of color. And it's important to understand that that's on a setting in which the the Black death rate was already higher than the white death rate, and other statistics for Black Americans are worse. So that raises the question of why. Why is this happening? And I'm going to start with a couple of definitions. So you've probably heard people talk about health disparities. Health disparities that are differences in health that occur at a population level. In other words, they're between groups, like between racial or ethnic groups, not at an individual level. But there's a term that I like better than health disparities for most of these, and that's health inequities. That is these differences, often exactly the same differences, that are avoidable, unnecessary, unfair, and unjust. Then to talk about racism. So there are different kinds of racism, and one is individual level discrimination, and that's things like racial slurs or refusing somebody's service or not giving them as good service as someone else gets. But there are other forms of racism. So one is cultural, which is embedding the idea of the inferiority in other non-white groups into the belief systems of the culture. And then there's also structural racism, which are structures, policies, laws in society that reduce access of people who are considered socially stigmatized to the kinds of opportunities and resources that allow people to flourish. Now, people often think of the individual level as what racism is, but actually cultural and structural racism are insidious, and they're actually more powerful and damaging than individual level racism. So, what are some of the factors that contribute to the toll from COVID-19? And you've probably seen some of these before. One is frontline jobs. Black Americans and other minorities are more likely to work on the front line, face-to-face with the public, more likely to be exposed to COVID. Housing. They're more likely to live in crowded circumstances. And if you live in a crowding housing situation, then even if you're told to quarantine or to isolate, you're unable to do so. They're more likely to live with environmental hazards. In fact, they're twice as likely to be exposed to air pollution. And people who are exposed to air pollution are more likely to have serious outcomes from COVID-19. More likely to lack access to healthcare, which obviously is a risk factor, and more likely to have underlying health conditions. So if we know those are the factors, that again raises the question, why? Why do these factors exist? Now, I could take any of the factors I've just named and more factors and go into great detail about all of them, but obviously none of us want to be here all night. So I picked a couple to use as examples. One is segregated housing. Many of you may have heard discussions of this in our community, and I just want to highlight a few things about segregated housing and how it came to be. So there are laws which go back to 1911. Even where there aren't laws, there's been intimidation and restrictive covenants. Now, then there's the New Deal, which I always thought of, and I'm sure most of us thought of, as rescuing Americans from the Depression, which is true. But I only recently realized how racist parts of the New Deal were. So the Public Works Administration subsidized housing, but it mainly subsidized housing for white people. And then the Federal Housing Administration, which was created during the New Deal, employed redlining. Redlining in its origins was actually drawing red lines around areas of maps. And in this case, this was restricting housing subsidies. That was in the 30s. Then after the war, at the end of the 40s, the VA actually adopted these same racial exclusion programs. And just in case we think all of that is ancient history, someone did a study in 2018 looking at bank loans and found that redlining still existed for bank loans just a few years ago. So what does segregation have to do with health? One study in Jackson, Mississippi showed that Blacks in the most highly segregated neighborhoods had twice as many heart attacks and strokes as those in the least segregated neighborhoods. And how does segregation matter to health? Segregation determines socioeconomic status. Home ownership is the main way that people accumulate wealth in this country. And what we saw from the other slide is that Blacks were restricted from home ownership, but even when Blacks own homes, their homes appreciate at a lower rate than white homes do. And the effect of that is that the median level of wealth for Blacks is something like 1/8 of what white wealth is. There are fewer jobs available in segregated neighborhoods. The schools are typically of lower quality. There are more environmental hazards, as I mentioned earlier, and there's less access to healthcare because there are fewer hospitals, doctors' offices. Now, again, just in case we think redlining is a relic of the past as far back as 2018, this is a study that was done since the pandemic, just a couple of months ago, published in the Charlotte Observer. And this was done in Durham, and it showed that people who lived in areas that were redlined had a higher COVID-19, a higher risk for a severe disease from COVID-19. So the other factor that I wanted to talk about was about underlying conditions. And I don't know about you all, but ever since the beginning of the pandemic, I've been hearing that the deaths were mainly in people who had underlying conditions. Well, that raised the question, what are the underlying conditions? And what underlies the underlying conditions? So this comes from Center for Disease Control. These are the things that are considered risk factors for severe illness from COVID-19. And I'm not going to read you the whole list. What I want to point out that there's several things on this list that are of higher prevalence in Blacks and or are typically worse. So chronic kidney disease, 1 out of 3 people with chronic kidney disease in this country is African American, obviously higher than their proportion in the population. Heart disease is more common, and diabetes, which is also an important risk factor, is much more prevalent in Black people. But why? What underlies the underlying conditions? So obviously, lack of health insurance and poor access to health care are factors that would make underlying conditions worse. One example is that in these chronic illnesses that we talk about, people typically are at more risk if their illnesses are uncontrolled. Well, when I was in practice, I saw lots of people who had diabetes. And if they were able to afford their visits to me, and if they were able to afford their medications, usually we could get their diabetes under control. But if they were a diabetic who didn't have access to medical care, they're much more likely to have poorly controlled conditions, and that put them at a higher risk. The social determinants of health are factors other than purely medical factors that have an effect on health. And often their effect on health is larger than the medical care that people receive. So what are some of these? One is poverty. People who are poor are at much higher risk for poor health. Another is lack of wealth. Now, I was talking to somebody about this and she said, well, isn't lack of wealth the same as poverty? But lack of wealth is really different from poverty. You can have a middle-class income and a middle-class job, but you may not have as much wealth accumulated as someone else who has the same income that you do. And wealth has a lot to do with your ability to withstand an illness. If you get a severe unaffected illness, it may be wealth that enables you to seek medical care at all. It may be wealth that allows you to pay until you reach your deductible. And it's also your savings, your wealth, that enables you not to be totally financially devastated if you have an illness and thus lose your home or become bankrupt. Education is another factor, which, as you saw, is often not as good in segregated neighborhoods. And then there's racism itself, which I want to talk about. So racism in itself is actually an underlying factor. And how does that happen? One is that it's been well documented that Black Americans get lower quality medical care than white Americans. They're less likely to have their pain treated. They're less likely to get necessary procedures and many other things. And not surprisingly, they are more likely to avoid care. NPR reported on a study a couple of years ago that showed that 22% of African Americans avoid care because of discrimination. And then there are also more direct ways in which racism has an effect on health. Chronic stress, including from racism, causes increased stress hormones and chronic inflammation, which is now thought to be the source of many different kinds of disease. Stress contributes to diabetes, obesity, depression, and high blood pressure. And you'll note among those that some of these are the factors that are high risk for COVID. And then there's also the issue of trust. And there's a lot of talk about trust now in the Black community, especially because of it's around the vaccines and whether people in the Black community want to get vaccines, whether they trust those vaccines. Now, trust is an issue that goes way back, and many people know about the Tuskegee syphilis experiment, in which Black men with syphilis weren't told that they had syphilis and weren't treated for it even when there was a treatment. But the maltreatment of Black Americans goes way before that, back to slavery and before, in the ways that they were poorly treated. And the community is aware. When I was in practice, I used to see people who wouldn't want to have certain things done. Like I can remember a couple of patients that I wanted to send for treatment for cancer. And they would say, oh no, I don't want to be experimented on. And at the time I would just kind of say, well, I'm not sending you for an experiment, I'm just sending you for treatment. And it didn't really register with me how profound and with what good reason they distrusted the medical system. So what many people say now is they ask the question of what do we have to do to get, what do we have to do to get Black people to trust us? But I really feel like that's the wrong question. The right question to ask is, what does the healthcare system and what do providers have to do to be trustworthy? There was a recent study that showed that less than 50% of people believe that systemic racism has anything to do with poor COVID-19 outcomes. So if you guys believe that it does, you're ahead. You can see you're ahead of much of the population. And then in this day and age, with our much greater awareness of racial justice and policing, I think it's really important to mention the role that violence, incarceration, and policing play. people have talked about there being two pandemics, the pandemic of COVID and the pandemic of violence. But what I want to show here is that they're not completely separate pandemics, that they're actually related. And I'll start with a few facts that many of you may be familiar with. Black men are almost 3 times as likely to be killed by the police. 1 in 1,000 Black men at current rates will be killed by the police, which I hope everybody here is as shocked by that number as I am. African Americans are incarcerated at more than 5 times the rate of whites. And incarcerated people are 4 times as likely to get COVID-19. Now, we know that violence obviously has an effect on the people who are affected by it, the people who are killed or who are injured, but it has effects on others as well. Youth who witness violence are more likely to have PTSD, substance abuse, depression, and generally poor health. Children whose parents are incarcerated are more likely to be depressed, to have PTSD and anxiety, also asthma and migraines, which we think of as physical illnesses. And people who live in surveilled neighborhoods, which are more likely to be Black neighborhoods, are more likely to have high blood pressure and obesity. And again, if you look at these outcomes, you see that many of these things are exactly the risk factors for severe disease from COVID. So I probably got everybody depressed now. That's the bad news. The good news is, well, if we recognize this, what we can do to move forward. So first, in terms of healthcare justice, what should we do about this? And one factor, of course, is Medicare for All. We're a Medicare for All organization, and Medicare for All would do a lot because it would level the playing field and everybody in the country would be able to get high quality, equitable healthcare. But it's by no means everything that we need to do to improve healthcare. Now, in the short run, I have to put in a plug for Medicaid expansion, and I hope I don't have to make this case to anybody who's here. It's a no-brainer. And if our state would expand Medicaid, it would help hundreds of thousands of people. We need serious COVID relief bill that covers health as well as other factors. And as a society, we need to address all these other things for fair wages, housing, education, which, of which I've shown you affect health and many other things. Now, one of the best places that you can find a description of the things that we need to do is from Reverend Barber's Poor People's Campaign. One of their documents is 14 Policy Priorities to Heal the Nation, which has a great, it's not just a list, it's a real outline of all that's comprehensive of the things that we need to do. And I heard Reverend Barber speak, and he said that somebody had asked him, said, you got all these things you're asking for. He says, but what's your real ask? What are the 1 or the 2 things that you really want to get done? And Reverend Barber said, oh no, we need them all. We need to get them all. And I hope that you would agree with that and that we would all commit to that. And then there's also what we need to do in the world of anti-racism. So the first thing is we need to name racism. We need to see it where it is and how it's affecting things. We can only address it if we acknowledge it. We need to teach our history. We need to teach, I remember learning about the Civil War. I can't remember much that I learned about Reconstruction, post-Reconstruction, or what I learned about how the mistreatment of African Americans in our country didn't end with the Emancipation Proclamation. So we need to teach that in schools. And we also need to teach in medical schools what our shameful medical history has been, again, so that we can address it. In our healthcare workforce and in other workforces, we need to move beyond diversity to inclusion so that we not only include diverse faces, but that we make other people feel included. Beyond inclusion to desegregation so that our workforces look more like our population. Now, one reason to do that is because it's been shown that Black people have better outcomes when they see Black doctors. Now, I have to say, as a white doctor who took care of lots of Black patients, I find that very painful to know. And I think we need to teach everybody to take care of everybody. But obviously, one of the things that we need to do now is to diversify our healthcare workforce. And as I was reading about this, a term that I ran into that I find compelling is the idea of cultural humility. Those in the majority culture need to have some humility about that and not feel that if we add other people to our institutions, that what we're saying is come along, be a part of us, and just join, participate in white culture. What we need to do is recognize everyone's culture and include it and really integrate it. In the words of Ibram Kendi, we need to not be, it's not enough to be not racist. We have to be anti-racist. The George Floyd social protests were called the largest social protest movement in the history of the United States. And so that raises the question for us about what we're going to do with that. Are we now going to eliminate racism, root and branch, not just clip little twigs around the edges, but actually dig up the roots and discard it? I hope the answer to that question is a resounding yes. And if it is, we all have lots of work to do.